Hello, welcome back to Unmasking the Trans Movement with Jon Uhler. I'm your host, Brad Wylder. Jon's off today providing needed therapy for multiple patients and helping do what he can. Listen, we've got a lot to talk about today anyway, even though he's not here. Dr. Gillies is filling in, and Dr. Ann brings with her some great story out of Florida where the Federal Court of Appeals has struck down Tampa, Florida's ban on sex orientation change. So, doctor, is that all about adults or is that about minors?
So this is for minors who are wanting to voluntarily come to therapists because they want to reduce or change their sexual orientation. Or it also would include those who are gender dysphoric and do not want to transition. They could go to a therapist with help with that. So these are really positive things coming out of Florida. The Court of Appeals sided with the Tampa family-based therapist named Robert Bazzo. And so they agreed with him that counseling should be open to anyone that wants it, and the client should have the ability not only to choose the counselor or therapist, but the type of therapy they want.
So it gives a minor options now as to how to proceed forward should they want this therapy or treatment. At the same time, I would imagine that our doctors still going to stay proactive on pushing the ideology of going ahead with these radical surgeries, or are we going to be seeing doctors starting to, back off a bit? I mean, there's money involved, right? And lots of.
Oh, absolutely. What I would say is that Florida has been setting some precedents anyways in this whole area. And they have actually, the government in Florida has actually delayed the starting of sex orientation and gender education within the public school system. I think it's to grade 3, or it might even be up to grade 5. So they are not allowed to start with that kind of training. And I think because of the atmosphere in Florida, which is more open to allowing an individual to explore instead of trying to push that individual into a particular way to go. And so you're talking about gender dysphoria leading to the transgender implementation, that doctors there are not going to be held with their feet to the fire. I think that they are going to be able to apply and send this child to therapists to utilize psychotherapy in helping get to the root of the issues, as they can now with those who are wanting help with modifying their same-sex attractions in one way or another.
So let's make it clear now with our viewers that this doesn't necessarily stop these surgeries from happening. All it does is it makes them go through a process in Florida before they get to that point of requiring or wanting that surgery so bad. And there's a lot of mental health processes that'll obviously be in place to go along with that to get them there. Now, there are radical parents out there who are pushing their kids in that direction, and obviously those particular parents are pushing their kids that way for a reason of, whatever it may be, troubles at home, always wish that they had a opposite gender, whatever it may be. And that being said, they're not going to be able to get those immediate surgeries in Florida anymore. So are we talking now about, minors and parents heading out of state and going other places?
Well, and I'm not sure that those who want and parents who want their children in this process of hormones and puberty blockers and all those things, they can still get those. I think that isn't banned, of course, but what is there's slowing down of the momentum that is now allowed.
Right,
So
I understand that, but we're trying. They're going to want to move. Some of these people want to move quickly, and they want to have it done, within the next 6 months.
Yep.
And they're not going to want to wait around for therapy and all that, and all the doctors to make a decision and a ruling. Now they're going to want to just go ahead, and they know they can go to another state like California or New York, and they can have her done by the end of the week.
Well, almost that fast. And it's there's lots of states that will recommend right off the get-go that children go through this process. And all the other states, as far as I'm aware, continue, well, I shouldn't say all, because I'm not aware of which states have conversion therapy bans in place right now, but a lot of them do, and the rest of them are pushing for them. So that's a huge issue. So in those states, therapists are not allowed to treat a child that comes and says, I don't want these unwanted feelings. They're unwanted. I don't want them. And you can't explore the underlying issues. What's going on? When did this start? Because one of the presuppositions is in other states and in Canada here is that children and adults too are born that way. They're born that way. You can't change it. And that actually has been scientifically proved to be not valid. There's been some really good studies out, and 2016, there was a really good one. And so the immutability, which means you can't change, really is not a basis anymore to stand on, because we know children and adults change, and it's called now sexual fluidity. So what Florida is doing is actually just validating what science has already known.
Okay, so now going forward, obviously the states are going to be in a position where some of those states are doing the right thing in terms of our eyes and what's going on, and other states aren't. Canada's a whole different scenario. That is another ball of wax, and I know that we could probably open up the can of worms on that. I believe that it's probably in my best interest to let Jon Uhler and yourself, the experts, have that discussion, while I have lots of questions that I can present. I just think it's more of a discussion versus a question and answer period with that particular topic, because it is rather lengthy. But touching on Canada just for a minute, just to kind of give us a little perspective of what we can expect in an upcoming show with Jon, what would you have to say about what's happening here in Canada briefly?
Well, there is no leeway for adults, let alone minors, to seek the therapy that they want in this whole area of sexuality, unless they are if they want to continue with same-sex attraction and gender ideology. Absolutely, they can have all those kind of those things in place. But for someone who doesn't want all those things, who really is challenged because they want to repress or reduce the thoughts and behaviors, any non-heterosexual attraction or behavior. And there are many out there that actually want to do that. In Canada, it's not allowed. And we'll talk more about that. Jon and I and you together in an upcoming episode.
That's fantastic. I want to thank you very much for your time today. I know you're headed stateside yourself. I wish you safe travels, and I hope when you get to see Jon, you give him a big hug from me. And again, I can't say enough about having you on the program. We just can't do it without the experts and the professionals, and we really appreciate your time. So thank you very much.
Thanks, Brad, for allowing me to talk about this tonight.
You bet. All right, on behalf of Jon Uhler, we are going to come back with more Unmasking the Trans Movement. Thank you very much for watching this episode. Stay tuned. There's lots more to come. We'll see you soon.